All right. Well, again, good morning, everyone, and thank you for joining us on what is yet again another surprisingly warm Friday morning. This is the third information session we are having for the Safety and Risk Assessment Tool Audit, which was completed in accordance with House Bill 241046. So we're going to go into the details and the background of the project. My name is Jordan Steffen. I am the Deputy Ombudsman for the Office of the Colorado Child Protection Ombudsman, which was the entity required by law to contract with a third-party entity to move this forward, move this audit ahead and submit it to the General Assembly. I'm going to pass it off to Donna, who will introduce herself and the rest of the ICF team.
Thank you. Hi, everyone. Donna Kleikholz. I am the research evaluator on the project along with Anna Gross, and nice to see you all here on a Friday morning. Thank you.
I'll chime in. Yes, I am, like Donna said, the other evaluator on the project involved in various aspects of the data collection and qualitative analysis. And I'll pass it over to Maddie.
Thanks, Anna, and thanks everyone for joining us today. I'm Maddie Langen. I'm also with ICF. I worked on the research side of things, and I got to work with our great lived expert group. And I'll pass it back to you, Jordan.
Jordan, you are on mute.
It's Friday. I want to hand it over to you, Miko, to introduce herself as well.
Yes, good morning, everyone. My name is Yumiko Doherty. And for this project, I really served as a liaison. I'm an independent contractor, a liaison so that the ICF team really had sufficient Colorado context for this scope of work. And were able to access kind of the people, the data, the reports, and things they needed to fulfill the statutory requirement.
All right, thank you, team. I'm going to go ahead and spotlight our team, and then I will pull up a PowerPoint to get us going. So let me get everyone on Spotlight. I appreciate your patience while I do this. Okay, just the obligatory. Can everyone see the PowerPoint I have pulled up? Fantastic. So again, welcome again. We're glad you're here. For those of you that are returning, thank you for coming back for a third information session. We're eager to continue hearing your thoughts and your feedback about the survey. Again, this is an information session for the audit produced in accordance with House Bill 1046. Before we dive into the audit itself and how it was produced, on behalf of the CPO, I want to give a little bit of background to how we came here, how the project came to be. House Bill 241046 originated from work presented by the Child Protection Ombudsman Office to the Colorado Child Welfare System Interim Study Committee during the summer of 2023. The CPO presented to that body 4 primary issues that we saw reoccurring as negatively impacting how services were being delivered in the child protection system. And one of the key presentations we made to the interim committee was recurring concerns that we saw with how the child welfare risk and safety assessment tool was being implemented. We presented to the committee that we were seeing inconsistencies in application, inconsistencies in impact for how that tool is being presented, and a really, really deep concern for whether or not it was being able to be utilized effectively in the trails or the child welfare database system. Following that presentation, the committee selected this as one of 5 bills that came out of that interim committee, and it passed effectively. And that legislation, again, House Bill 241046, required our office, the Office of the Colorado Child Protection Ombudsman, to contract with a third-party entity to do an in-depth audit of the risk and safety assessment tools. The bill also put parameters around what the audit was to look at. So you will see as we move through this presentation that the findings, the methodology, all were designed intentionally to answer the questions put forward in the 9 directives included in the statute. I won't go through these in depth on this slide because we'll be getting into them in a moment. But again, these were the guardrails. So there have been some questions about why the analysis maybe didn't move in this direction or why it didn't include that. And that is because the statute very clearly laid out, based on input from our office and other stakeholders during the process, what we wanted to focus the attention of this third-party evaluation on, given limited resources and time. Also very important to note how the CPO went through the procurement process in selecting the vendor to complete this audit. Pursuant to fiscal rules and the legislation itself, the CPO put out a request for proposals on a public database. And we knew early on that it was going to be very, very important for this to be a collaborative process from the get-go, right? We wanted input from our community agencies, our community partners to understand what was going on. And as a result of that, we assembled an evaluation team with representation from multiple entities in the state, and that included representation from the Division of Child Welfare, County Departments of Human Services, Office of the Child Representatives, Office of the Response Parents Council, and a parent with lived experience who came together to review applications, proposals, I should say, score them independently based on streamlined criteria. And ultimately, ICF was chosen as the third-party contractor to conduct this audit. With that, I'm going to turn it over to ICF so they can tell you how we started this important work.
Thank you, Jordan. I'll briefly go over CPO and ICF's role in the audit here. So CPO provided the overall oversight to ensure that ICF researched and audited the critical elements of the statute. CPO partnered with Yumiko Doherty of Ignite the Change LLC, who you met earlier, to serve as project manager and a liaison between ICF and the state and counties, really ensuring that ICF team understood the context of Colorado's work more locally across the state, county, and other stakeholder team members. And then ICF's role centered on designing and refining methods for research, data collection, engaged various stakeholders to hear their experience, and collecting, analyzing data to compile as reflected in the findings in the final report that met each directive of the audit that you could see there. And we're going to dive into these a little later, so I'm also not going to go over these here. And we can move to the next slide. Thank you. To address all the requirements outlined in HB 24-1046, the ICF team developed a multi-level mixed methods approach design to capture individual, family, and system-level perspectives. This integrated design enabled the team to corroborate findings from multiple data sources, mitigating single method bias and enhancing the rigor of the audit and reliability of the results. As you can see in this approach, really emphasize stakeholder engagement throughout. In the visual here, it is throughout the whole process. And in our time today, we'll review the team's methodology, data sources, and a review of the findings per directive that you saw on that previous slide there. And we can go to the next slide. ICF's work and activities throughout the months is reflected here. We engage stakeholders throughout our process, as I mentioned before, to allow for the most robust process possible beginning in late winter 2025 through winter of 2026, so the whole process. Each phase of the audit built upon the efforts and findings of the previous months. So, for example, the research on best practice and discussions with work group participants really informed the development of rubrics for evaluating Colorado assessment tools, policies, and cases. It also informed the development of survey, focus group, and interview questions. And now I'll move more into detail on engaging those stakeholders that I've been mentioning. Thank you. So I'm going to walk through a key part of our engagement strategy that I mentioned previously, which was collaborating with the stakeholders who know the system and tool best. This ensured that our findings were not only technically sound, but also grounded in the realities of those that are most impacted. So we had two ongoing stakeholder groups, the lived experience work group, bringing the voices of individuals with that direct lived experience in the human services system in Colorado to the table. And we also had a human services work group, which I'll refer to as the work group, the work group, which is really a mouthful, but composed of county level caseworkers and supervisors from across Colorado. These work groups met monthly, providing continuous feedback and guidance on the work. We also engaged in targeted interviews and discussions, which we'll dive into a little deeper later. The work groups and their contributions ultimately ensured that we had that local context and that shared experiences were a part of the data collection process. But before I expand on the contributions, I'm going to walk us through our recruitment process and also who was in these groups. Thank you. To ensure we included the right voices, we began by sending formal invitations in an interest form to a diverse group of potential participants. And you can see those to the right of the slide here in blue. So for our workforce work group, we sent out invites to the 64 county human services directors through Colorado Human Services Directors Association. And for our lived experience work group, we sent them to the following organizations listed and also did some more targeted recruitment for areas that were lacking representation. When reviewing responses, we considered a lot of factors to ensure that there was meaningful representation. So some of those considerations were the type of lived experience folks had, so including current or former foster youth, parents with lived experience, kinship providers. Workforce experience, we did prioritize folks who are on the front lines using the assessment, so that would be caseworkers and supervisors. Familiarity with the tools, race and ethnicity, regional representation, and then, of course, availability to participate in these monthly meetings. Lived experts were compensated for their time and contributions. And then on the next slide, we can get into the demographics of some of these groups. Well, both work groups. Thank you. For the lived experience work group, we had individuals across 4 different regions, each bringing unique perspectives based on their lived experience. This included parents with lived experience primarily and 2 former foster youth. For the workforce work group, we had frontline staff across 5 different regions, representing 7 counties, and we had 5 caseworkers and 3 supervisors on that group. Now to expand more on those contributions that I mentioned earlier. These work groups served as a primary source of information and really ensured we had that local and lived experience lens on this evaluation. Using various data collection processes, we use the work group meetings to gather information on each area of analytic focus in the legislation. We use structured discussion guides in the work groups to explore topics like the barriers to completing assessment in real time, and also gathering suggestions, the impacts of race and ethnicity on practice and decision-making, geographic variability, how assessments are being used for domestic violence and intimate partner violence, perceptions of the tools widely, how assessments are used to support case decision-making, and feedback on Colorado's current practice compared to identified best practices. These work groups allowed us to capture firsthand insights from those that are closest to the work and the families being served. As we all know, these voices are essential for driving meaningful, lasting change. I'm now going to kick it over to Anna to walk us through the review of documents and the best practices that I briefly mentioned.
Thank you, Maddie. Okay, so like Maddie mentioned when reviewing the project timeline, along with kicking off those initial work groups early on in the project, we conducted a foundational literature review to gain an understanding of the best practices associated with safety and risk assessments nationally. To do this, we used a systematic process starting with identifying search terms and inclusion criteria, then screening titles and abstracts, then full texts, and finally synthesizing the results from 30 finalized articles selected as the most relevant. We didn't just stop there, though, after we did the initial review. We continued this process iteratively throughout the entirety of the project. There were some cases actually where research was published since we started the timeline. So included those, and then also project partners directed us to various resources. A major takeaway we learned from this process is that there is definitely more research needed that explicitly examines best practices associated with safety and risk assessments in the child welfare context. The articles we did find at the beginning of the project and iteratively served as the foundation for creation of our data collection protocols. Like Maddie mentioned, the timeline really built upon that initial process and then later on our data analysis. The resulting publications from this research are included as citations in our final report. Moving on to our next part of the methodology, the review of Colorado documents. HB 241046 specifically calls for the audit to identify tools and resources to ensure the assessment is carried out consistently. So to comply with this directive, ICF developed a comprehensive document request outlining the types of materials that we thought were relevant to the audit. ICF used a systematic approach to review these documents. And a document review rubric was developed based on national best practice research that I just talked about, as well as input from the work groups that Maddie outlined, and then applied to materials submitted by state representatives. We've got all of that outlined in one of our appendices in the report. This rubric examined key criteria related to tool design and guidance, like clarity of definitions, use of plain language, completion requirements, and consideration of caregiver and child factors. And then also the rubric took into account training-related criteria like the availability of interactive learning opportunities and attention to bias, cultural responsiveness, as well as risk assessment criteria, like definitions of risk, use of prior abuse and neglect, and differentiation between abuse and neglect scoring. So, moving on, the next part of our methodology on the next slide was focus groups and interviews. And the purpose of these was to collect more in-depth perspectives from various project partners that weren't already affiliated with the project work groups we talked about. To do this, the ICF team conducted 6 focus groups and 2 stakeholder interviews. We did these virtually via Microsoft Teams. You can see the list of the groups we spoke with on the slide. We, of course, got participant consent for recording and transcription. We securely stored audio files and made sure that identifiable information was never linked to specific comments or views in any of the documents. This access to this information was restricted to authorized ICF staff. We then used a thematic coding approach across all qualitative data and developed a code book that aligned with the HB 241046 bill requirements, and then mapped those bill items in the code book to conversations to key items. We also used an open coding process, which just means that coders looked at the transcripts to identify and label emerging concepts without using that code book and preconceived categories. This approach allowed us to remain grounded in the data and responsive to unanticipated themes that may have emerged outside of the bill items. Transcripts were uploaded, and we used Deduce as the qualitative coding software for this entire process. I will move us over to the next slide. So to also capture more perspectives more widely, the ICF team also designed 3 tailored surveys targeting county workforce, legal professionals, and individuals with lived experience. Each of these surveys were customized to the audience, and questions were organized according to the audit items. And I just want to point out in the sampling methods box on the left-hand side, I've listed the number of folks who responded to each survey. So we've got 157 workforce responses, 46 legal professional responses, and 18 individuals with lived experience who responded. The questions on these surveys combine Likert scale items, so agree to disagree, ranking sort of items with open-ended responses to capture both quantitative and qualitative insights. We also, in the workforce survey, included an additional component to assess inter-rater reliability, which was one of the bill items. And Donna will talk more about this at the end of the presentation. But briefly, it required respondents to review hypothetical scenarios and determine whether imminent danger was or was not present. The purpose of this was to ensure information was gathered about that inter-rater reliability item and determine sort of consistency in decision-making. Prior to distributing these surveys, we reviewed these scenarios with the workforce work group for accuracy, and then also had the lived experience work group review the survey to ensure cultural relevance, framing, and accessibility. Once the survey closed, we exported the results from Qualtrics, cleaned the data, and imported into a statistical software platform for editing and analysis, SPSS. We also used a qualitative analysis of open text survey responses to identify emerging themes. With that, I will pass it over to Donna to talk about the rest of the methods.
Okay, thank you, Anna. So we're going to be talking about the case reviews. So as a complement to the other more expansive data sources with larger groups, the case review process was designed to evaluate how the Colorado's family safety and risk assessment tools are applied and documented in the case review files. The goal was to assess alignment with policy, consistency in application, and variation in risk and safety determinations, using a sample representative of the larger population, but also within the time and budget constraints of the audit. The ICF team worked with DCW to implement a stratified sampling approach based on known variance factors such as location, race, and ethnicity. The sampling included cases of families that have been involved with the Child Welfare Agency. ICF worked with DCF DCW to identify a targeted sample of 16 that would meet these requirements. The data was de-identified and personal information was redacted from the files. No other information was redacted. So just as an aside, unlike standard CFSR reviews, which typically include at least 65 cases for a broad systemic assessment, this focused approach emphasized intensive fidelity testing over sample size. Since it was a small sample, this allowed us to integrate and triangulate case file data with the other data sources that we had collected and stakeholder input to evaluate the application of the tools at key decision points. For example, just a small example, the assessment tool has a checkbox, if the tool to be checked if it was completed with the family. All the assessments checked yes when we looked at them. However, when we looked at the case logs in the case files, it was not clear at all that the assessments were done at the first contact. Additionally, we heard from frontline workers very clearly, both in the quantitative data and in the focus groups, that it's very challenging to complete the assessments in real time with families in the field, and that only 32% said that they do complete them in real time, just to give some perspective to that. We created a comprehensive rubric to systematically capture and analyze the quantitative and qualitative data from the case files. The rubric components evaluated quality and completeness of the case files and the safety and risk assessments separately. Overall case ratings were made using basic criteria that are outlined in the Volume 7, and that we combined that with best practice elements that are outlined in the American Bar Association's publication called Child Safety, a Guide for Judges and Attorneys, which provides a rigorous framework for child and safety assessment and establishes a consistent model for judges and attorneys. The key elements established a structured, fact-based analytical process for child welfare decisions. So we had 5 cases that were closed at assessment with no determination. We had 5 cases with an initial determination of an at-home placement, and the tools were applied at assessment and through ongoing casework. We had 6 cases with an initial determination, and the child and youth remained in the home with a safety plan. Some samples of reasons for referral included abandonment, sexual abuse, substance abuse, domestic violence, sex trafficking, health and hygiene, suicidal ideation, physical and psychological abuse, and violence involving guns. Ages of the victims range from newborn infants to 15 years. 8 victims were female and 7 were male, while a remaining case cited 4 victims that were equally male and female in the family. The allegations were most often characterized as injurious environment with abuse and/or neglect. We calculated a total score based on the criteria that I just described above, and each total score was then compared. All the case files identified included at least 1 complete safety assessment and risk assessment. Additional case documentation such as contact logs, additional initial assessment summary, case safety closure information, and referral summaries were also included, providing us rich contextual and qualitative information. Next slide. So our overall analysis approach to address the requirements of the directives, the ICF team developed, as was mentioned earlier, a multi-level, which is means to capture individual, family, and system level perspectives, and a mixed methods approach, which we just described, which included the best practice literature review of relevant documents, surveys, focus groups, lived experience work groups, workforce work groups, and interviews with individuals that had deep experience with tools. Qualitative data was analyzed using thematic coding methods, as Anna described, and this convergent design enabled the team to corroborate and triangulate findings from across all of these data sources. So this figure here displays sort of the different data sources and how they combined and worked together to create the findings. The approach emphasized the stakeholder engagement and the iterative stepwise data collection, with each stage informing the next, sort of a cascading effect. The team included subject matter experts in child welfare safety assessments, program audits, and lived experience. I am going to pause here because we've just concluded sort of the introduction and methodology sections. And before we go into the actual findings, we wanted to provide an opportunity for anyone to ask questions. I don't know if everybody heard Jordan at the beginning say, if you have any questions, please put them in the chat and we'll address them. If you have any questions in the chat, we can talk about them now. You can hold on to them, or you can come off mute and we can try to answer your questions. Are there any questions in the chat?
I don't see any questions in the chat presently. Would anyone like to come off mute with any questions? Okay. Well, I think we're good to move on, but if a question does arise that relates to methodology, you haven't missed your chance. You're still welcome to put it in the chat, and we will reserve time at the end of the presentation for all questions again. So
Right.
Thanks, Donna.
Okay, I'm going to toss it over to Anna for the next slide.
Thank you all. Cool. So I'll kick us off talking about findings and then pass it back over to Donna to finish it up. In terms of findings, we want to emphasize that this audit, like Donna just described in the approach to methodology slide, this audit was designed to provide a 360-degree review of the safety and risk assessment tools. So we used numerous data sources to aim to create a comprehensive view. Before we dive into specific findings and recommendations, we want to first reflect our understanding of the overall strengths of Colorado's system, as well as the contextual factors that informed our analysis. First, with strengths, across all data sources throughout the entirety of the project, engaging with all partners, we observed a strong dedication and commitment to quote unquote getting it right, like it says on the slide. We know the Colorado workforce really cares about this assessment and ensuring great outcomes for youth and families. We also observe that tools are aligned with Colorado policy. That is in reference to Volume 7. There are clearly defined safety thresholds that are being used by staff. New worker training incorporates opportunities to practice using the tool, and caseworkers demonstrate strong agreement on clear safety threats, like Donna talked a little bit on the case review side, related to injury, substance use, sexual abuse that warrant removal decisions. And like I said a bit ago, Colorado benefits from a committed workforce capable of driving meaningful improvements through targeted reforms. In terms of contextual factors, we recognize that there are funding and budgetary conversations and constraints occurring that impact staff and community organizations at every systemic level. We also recognize the structure of the child welfare system as state supervised and county administered introduces variability in local implementation and also allows for flexibility to address local needs and adjust to resource limitations. And then just note, like any system, there are ongoing organizational changes. So in a moment, I will transition us to reviewing our findings by legislative directive. So we've got one slide per directive. They are summarized and represent our synthesis of findings across data sources. So that's the literature, research, the document and case reviews, work group conversations and focus groups, and then the surveys. So what we share is representative information gathered through all of the data collection methods mentioned above and in our methods. We will highlight some survey findings and quotes throughout, but just want to remind folks that no data point is presented as a standalone in our report. The information is meant to be taken together. And then I mentioned the survey response rates were mentioned on that initial survey slide and can mention those again if that's helpful. So with that, I will have us look at Directive 1 together, which was identify tools and resources to ensure risk and safety assessments are carried out consistently. So like I said in the strengths list on the previous slide, a major finding of this audit is that tools are well aligned with policy standards and contain guidance for assessing safety, danger, and risk. The instructions are there and available. However, across data sources, we also found that though the guidance and instructions exist, conceptual clarity for tool constructs remains unclear. A few examples of this include definitions like primary and secondary caregiver and how those are operationalized, conceptualizations of vulnerability, and also concepts like caregiver functioning. Additionally, specific to the risk assessment, there is an over-reliance on historical factors. Not to say that historical factors shouldn't be taken into account, but we observed an over-reliance. And then together, this inconsistent conceptual clarity, imprecise definitions, and risk assessment challenges introduce possible bias and inconsistency in documentation. The subjectivity was also noted across our data sources through commentary around the tools not fully supporting complex family situations like domestic violence or various cultural considerations. Recommendations related to these findings include redefining safety and risk using observable, behavior-based criteria to reduce subjectivity. We also recommend revising or replacing the risk assessment tool and reducing reliance on historical factors. We recommend strengthening fidelity monitoring statewide across both assessments, safety and risk, and then also ensuring aligning policies with ethical and equity standards to minimize unintended harm on the community. A couple of survey metrics to point out on the workforce survey, 48% of folks agreed tools are applied uniformly. And then on the legal survey, 66% of folks disagreed that the tools are applied uniformly. With that, let's look at Directive 2. This directive was identifying gaps in solutions to enable caseworkers to complete the risk assessment or safety assessment in real time while in the field. So findings from multiple data sources indicated significant challenges in the reality of completing safety assessment or risk assessment tools in real time live with families. Our results suggested that technological limitations, time constraints, and tool complexity are primary barriers to real-time assessment completion, leading to documentation inconsistencies that further complicates verification of family involvement. So really that family engagement piece of the real-time assessment completion is a real barrier and real factor. Instructions require assessments to be completed with families, but lack guidance on documenting this or explaining results in real time to families, and also just the logistics around doing so in a real time setting when there's a lot going on and you could be lacking internet or, in a very varying sort of location settings complicate things. And then the completing family safety assessment tools sometimes indicate that family participated, but family risk assessment tools rarely did. Recommendations related to this directive include strengthening real-time documentation capability via mobile offline tools and underscoring here a simplified design. And then improving documentation of family involvement with explicit fields and aligned narratives that capture more sort of qualitative or narrative sort of explanations that can explain complexity. And then to highlight a survey item here, 32% of workforce survey respondents reported being able to complete assessment tools in real time during field visits. Next slide. Our third directive was examining impacts of geography when using risk or safety assessment. Main takeaway here, both the safety and risk assessment tools are not applied consistently statewide according to our findings across data sources. Differences in county resources, staffing levels, technology infrastructure, supervision capacity, and community service availability, especially between urban and rural contexts, drives varied implementation. Geographic variability significantly affects the consistency of tool implementation across counties. For example, larger counties or counties with more resources face complexities when families span multiple jurisdictions, and rural counties struggle with limited service availability. These differences underscore the need for flexibility and clarity in tool design to accommodate diverse contexts related to resource availability. A quote that we highlight related to that resource availability, one respondent said, a safety assessment in a metro area that has 300 Medicaid providers is going to look very different than the community that has 4 Medicaid providers and 1 nonprofit. Some survey findings here for the lived experience survey, 67% of folks did not think that assessments were implemented consistently geographically. For legal professionals, 24% in the survey agreed tools were applied uniformly statewide. In the workforce survey, 57% perceived the tools are used consistently regardless of location. So little variability across the three survey groups. Recommendations related to geography, similar to that real-time completion recommendation, investing in technology access. So that's mobile devices, connectivity, things like hotspots, and making sure technologies, laptops, tablets, that sort of thing, are available across counties, regardless of infrastructure, to enable real-time documentation and ultimately reduce disparities dependent on technology resources. We also recommend creating shared service models for supervision and consultation and providing surge staffing for small or less resourced counties. And then also address service availability gaps by partnering to expand healthcare, behavioral health, and housing supports across many systems, partnering with many systems, and adjusting tools guidance where resource scarcity persists for how folks can adapt. And with that, I will pass it to Donna to review the rest of the findings.
Okay, great. Thank you, Anna. So we are now on Directive 4, which focuses on examining the impacts of race and ethnicity when using the risk or safety assessments and how they affect communities that are overrepresented in the child welfare system. The document review showed that race and ethnicity are inconsistently documented in assessment tools, limiting analysis of disproportionality, and some case notes observed in the case review included subjective language without context, making it very difficult to decipher the race and ethnicity of caregivers or children or youth. Further, the reliance on economic factors as part of the risk assessment reinforces the conflation of poverty and neglect in child welfare, which can impact overall risk scores and decisions. Communication with families is often unclear and culturally misaligned, reducing trust and engagement. Colorado's current child welfare assessment tools and practices were reported to not be culturally responsive, and in many cases actively perpetuate racial and ethnic inequities, primarily due to inconsistent documentation, as I mentioned, biased use of historical data, and limited cultural understanding and ineffective communication with families. So for example, and I think it's most relevant coming from the lived experience survey respondents, 60% felt that their values and beliefs were not respected, and only 27 of the respondents believed the process honored their cultural history, race, and ethnicity. So what we recommend is standardizing the culturally responsive documentation that ensures family histories, strengths, and cultural identities are captured accurately and respectfully. Redesign the tools to reduce embedded bias by limiting reliance on an outdated or disproportionate records. Integrate and strengthen family diversity and bias mitigation training for staff. And adopt engagement methods that center on family voice and agency. Next slide. So Directive 5 was to evaluate and recommend best practices for sharing the risk or safety assessments with legal professionals, families, and the judicial branch. So as you know, clear communication of safety and risk assessments findings to the families, child welfare partners, and judicial professionals is essential for transparency and informed decision-making. Families and legal professionals rarely receive assessment results in a timely, clear, or understandable way, creating widespread transparency issues and undermining the trust in the child welfare process. Our results revealed inconsistent practice across counties and the need for culturally responsive, plain language communication. The safety, risk, and assessment results are inconsistently shared with families and legal stakeholders, lacking clarity, cultural sensitivity, or literacy appropriate communication. And we found that results are often not shared with legal professionals until the judicial discovery process, if at all. Some examples of the survey's lived experience survey, only 13% felt the safety and risk assessment process was clearly explained. And the legal professionals, 76% felt results are not shared in ways that respect the cultural and literacy needs of the families. So what we recommend, some recommendations, standardize the statewide assessment for sharing protocols for families and legal partners, require timely, plain language sharing of results directly with families, strengthen training and coaching for caseworkers in communication and cultural responsiveness, and promote transparent, family-centered communication practices. Next slide. So Directive 6 focuses on evaluating and recommending best practices for training on risk and safety assessments. The training on the risk and assessment tools exists as part of a very extensive 109.5-hour foundational training for new caseworkers that they complete in a 3-day safety through engagement seminar. The course description notes the tools will be incorporated in learning through the facilitation of assessment using the tools. In fact, 91% of staff reported receiving the CWTS training. Our findings indicate that training for new staff, however, is heavily front-loaded and theoretical, inconsistent across counties at the county level training, and insufficiently practice-oriented. Caseworkers feel overwhelmed and need more applied learning, coaching, and cultural humility training. Across all data sources, stakeholders consistently identified gaps in training and application of training related to the risk and assessment tools. Academy training is often described as limited, overly conceptual, and not reflective of real-world casework. Supervisors frequently serve as interpretive authorities. That's a good thing. Timing challenges reduce learning transfer when training precedes field experience. So the new caseworker training is given at a time when new caseworkers have really not had enough case experience in the field to really understand the information and apply it. Overall, while the formal training exists through CWTS and there are county-specific programs, its effectiveness is limited by timing, varied content, and instructional planning and delivery, a lack of consistent practical application. So some sample results from the workforce survey. These questions around training were only given to the workforce because they would be the only ones who had experienced the trainings. 91% received the CWTS training. 43% had training on addressing racial and cultural considerations. 62% felt prepared to use the tools, and 69% felt confident applying the tools. What we recommend is expand the application-based real-world training for staff, mandate training on cultural humility, bias mitigation, and trauma-informed skills, and optimize the timing and sequences of the training to better align with the workers' field exposure and also include boosters and refreshers. Next slide, Directive 7. Examine the risk and safety assessments for domestic violence or intimate partner violence and recommend best practices. So the current family risk assessment tool includes 2 DV, domestic violence related questions, with clarifications only in the instructions, but not in the tool itself. Language can be punitive or victim blaming, and DV history is inconsistently defined. It's unclear how the tool actually drives decisions. Concerns center on victim blaming language and a lack of nuance around coercive control. The lived experience work group flagged phrases such as caregiver engages in domestic violence, or parent is unwilling to protect as victim blaming. These types of phrases fail to capture the complexity of coercive control, which can occur over a long period of time. Their suggestions included revising the DV IPV related items to use more neutral, accessible language, remove punitive phrasing, and incorporate transparency by sharing that plain language summaries with families. Some examples from the survey: the lived experience, 57% of parents reported experiencing DV-IPV issues during their child welfare involvement. However, 100% of parents disagreed that their family was adequately assessed for DV-IPV. On the workforce survey, respondents, only 19% felt the tools are sensitive to cultural considerations when assessing DV and IPV in racially and ethnically diverse families. Collectively, these findings reveal systemic gaps in language, guidance, and application, emphasizing the need for trauma-informed, culturally responsive, and pattern-based approaches to DV-IPV assessment within the Colorado's child welfare system. Next slide, Directive 8. We're getting toward the end. Directive 8 focused on the inter-rater reliability of the safety assessment. So as Anna described earlier, inter-rater reliability in the audit was assessed using 5 case scenarios that were incorporated into the workforce survey. Only the workforce participants completed these. They were presented with the hypothetical scenarios, which were 1 to 2 paragraphs each, and asked to determine whether impending danger was present. The interrelated reliability was evaluated in this way due to inherent challenges of trying to do something like this in the real-world environment. The percentage of agreement for correct answer about whether impending danger was present or not for each scenario ranged from 59% to 94%. The results showed notable variability across scenarios, highlighting some persistent subjectivity in how workers assess impending danger, especially in situations involving neglect, which is unmet basic needs, or hazardous living conditions, which suggests inconsistent interpretation of key safety concepts. Overall, the exercise underscored the need for clearer guidance and additional support to promote consistency in evaluating impending danger. More practice is needed of distinguishing abuse from neglect, and differentiating imminent safety threats from conditions that can be improved would be beneficial. So one of the samples on the workforce survey only, again, the percentage of agreement on whether impending danger was present range from 59 to 94. And I just want to point out that the lowest percentages were on these situations where it was neglect and it was unclear to the rater whether there was impending danger. Where it was very clear, it was 94%. So it really was these two different groups between abuse and neglect. And Directive 9 required auditing the documentation for planning and removal of a child from the child's primary caregiver. Across perspectives, participants expressed concern that assessment tools alone do not provide a full or reliable picture for determining child safety, highlighting the need for clearer guidance, stronger engagement practices particularly, and more comprehensive documentation to support transparent and accurate removal decisions. In the case reviews, they provided insights into how decision-making occurs in a variety of case types. For example, the 6 cases that had an initial determination of current or impending danger, where the child remained in the home with a safety plan, documentation on these cases provided a thorough exploration of the threats of danger and efforts to keep a child in a safe situation with the family. 5 cases had an initial determination of current or impending danger, some with police involvement, and the children were placed out of the home. The contact logs for these cases provided considerable documentation of efforts to protect the child through an out-of-home placement, place the child with kin, and in 2 cases, reunification was achieved. Despite this, the lived experience survey respondents felt generally uninformed about the assessment and decision-making process. Only 7% felt the decisions made during the assessment felt fair and consistent. On the legal survey, only 22% believe criteria within the tools clearly differentiates when removal is warranted versus in-home interventions may be more appropriate. The workforce survey differed. 64% report they consistently use the tools as the primary basis for child removal. Overall, the findings show that Colorado's family and safety risk assessment tools are intended to guide consistent and objective decision-making. However, we found that they often fall short in practice due to subjective terminology, limited ability to capture some family nuances, and documentation challenges, and importantly, inconsistent family engagement. So the audit generated a multitude of findings and accompanying recommendations. The report is extensive. In an effort to consolidate the key themes and recommendations, we start first with the tools themselves. Although aligned with policy, there is a need to clarify definitions of safety and risk, particularly in terms of observable behaviors in the safety assessment and reducing reliance of historical factors in the risk assessment. These improvements in the tool clarity and reliability will require enhanced training with practical case-based learning. This is timed to optimize and align with the worker's field exposure. To improve consistency and real-time completion, there is a need to expand mobile and offline technology access, which also is needed to improve consistency across geographic regions, but also due to differencing in population needs and available resources, you should consider a shared services model across counties and regions, surge staffing for smaller counties, and flexibility in some requirements for counties with fewer resources and staff to complete quality assessments. However, the tools and training resources to effectively implement the assessment tools ultimately have the greatest impact on families. As a result, it's critical to ensure that the tools are culturally responsive. We recommend standardizing the data on race and ethnicity and expanding training on cultural humility and how to mitigate personal bias. The state has acknowledged the need for more effectively assessing DV and IPV. This rang true in our findings. We recommend adding indicators of coercive control, removing victim-blaming language, and standardizing the DV-IPV language statewide so that all agencies and partners are aligned in definitions and in recognizing the indicators of DV DV/IPV. Finally, decisions such as child removal versus in-home safety planning need to be clearly and consistently communicated to families and legal professionals in a timely and culturally sensitive manner. The findings conveys serious concerns about inconsistent implementation, inequitable outcomes, and gaps that may compromise and impact child and family safety. Stakeholders expressed worry and frustration, and at times fear that the tools do not work as intended. These concerns are not directed at individuals, but at systemic issues, inconsistent county practices, lack of technology infrastructure, unclear definitions, and tool designs that do not match real-world practice. A persistent theme emerged from all of our data, and that was a compassion toward families who feel confused, judged, and harmed by the process, and toward caseworkers who struggle with overwhelming workloads, inadequate training alignment, and complex and unclear tool requirements. Colorado really benefits from a committed workforce capable of driving meaningful improvements through targeted reforms. At that, we conclude our presentation and are open to questions. Thank you so much for your attention. It was a lot of information, a lot of talking. Thank you.
Great. Thank you so much, Donna, Anna, and Maddie. So we are here to answer questions. Also, just want to acknowledge if this is not the space that you find most beneficial to sharing your questions, I am going to put my email in the chat. Please send us your feedback. We really do want to hear it. We want to answer any questions, address any concerns, and really just want to hear how this report is landing for you. So as I said, I will be dropping that in the chat. If that's a better methodology for you to get us your questions, please feel free to use it. But while we have the team here, are there any questions that we can address in this space? I know it's Friday. I know it's Friday.
And early.
It's early. It is.
It's a lot of information to take in. So you may need time to just sort of let it sift through and settle, and you have time to contact Jordan at any other point also to ask any questions.
Absolutely. And this recording and the recordings of the 2 previous sessions are available on the CPO website, as well as the PowerPoint, which thank you, Yumiko, for putting that in the chat, as well as the report, additional information. So again, we really want to get everything out there, let this live in transparency, and answer any questions you have as they may come up. However, I am also not for making people sit on Zoom calls unnecessarily. So I think myself and the ICF team will hang out for about another 10 minutes, but if you don't have questions and you feel like you have enough to kind of ruminate on some of this, please feel free to hop off, but we'll stay on for about another 10 minutes or longer for folks who want to come off mute and ask questions. But for those of you that feel this was sufficient, you're also free to hop off. And thank you so much for coming. All right, I see we still have 2 participants, Jess and then okay, thank you, whomever is on the iPhone. Thank you for coming. Jess, do you have any questions for us? Okay. I think maybe it's a Friday case, so I'm going to go ahead and stop the recording, team, if we feel that's appropriate.